Autism, Early Signs, Introduction. Autism is a medical disorder that appears in early childhood. It affects a child's development by affecting his or her ability to communicate and interact with others. It is estimated that up to 1 out of 100 children in the United States have autism. Autism ranges from mild communication or behavioral symptoms to severe autism. In severe cases, a child may completely lack the ability to communicate or interact with other people. There is no cure for autism. However, early treatment can help many children have a better quality of life. This health education program is for parents and caregivers of children. It helps them understand what autism is, what signs and symptoms to look for in children, and when to seek medical help. What is autism? Autism is a disorder that appears in children usually before the age of 3. It affects how children grow up and develop in 3 ways. 1. Language, or how they talk. 2. Social skills, or how they respond and initiate communication with others. 3. Behavior, or how they respond in certain situations. There are different types of autism, and the symptoms of autism vary a lot from child to child. That is why this disorder is referred to as Autism Spectrum Disorder, or ASD. Autism affects children of all races and nationalities. Autism is a group of disorders with symptoms that range from mild to severe. Press true or false. Correct. That is why this disorder is referred to as Autism Spectrum Disorder, or ASD. There is no current cure for autism. A child with ASD is expected to live with autism for the rest of his or her life. However, with early detection, there are many treatment options which can help a person with autism improve his or her quality of life. Some adults with autism are able to work and live on their own. Others need a lot of help, especially those whose thought processes or intelligence has been affected and/or those who are unable to speak or communicate. The quality of life a child with autism will have in his or her adolescence and adulthood depends on how soon the autism was diagnosed, its severity, and the intensity of personalized treatment the child receives. With early and intensive treatment, most children improve their ability to relate to others, communicate, and help themselves as they grow older. This program will help you learn about signs of early childhood autism and when to seek the help of healthcare professionals. The earlier autism is diagnosed, the more likely the treatment will be successful. Press true or false. Correct. There is no cure for autism, but there are treatment options to help autistic children have a better quality of life. There is a cure for autism. Press true or false. Correct. Though there is no cure, healthcare providers have a variety of treatments and therapies to help children with autism help themselves as they grow older. Causes. The causes of autism are not well understood. In addition, autism is not a single disorder but a spectrum of many disorders. That is why scientists are confident there may be many causes for autism spectrum disorder. Scientists are studying many theories about the genetic and environmental causes of autism so they can learn how to treat it better. Statistical research tells us that the likelihood of having an autistic child is higher if there is a history of autism in the family, if the child is a boy, if the father is older than 40, if there is a history of certain genetic and neurological disorders in the family. Some theories have been suggested about the causes of autism, but these have not been proven. The following are some of the unproven theories about the causes of autism as of the date of publication. Changes in the digestive tract, diet of the child, poisoning by mercury, sensitivity to certain vaccines. Doctors can tell the exact cause of autism in children. Press true or false. Correct. Scientists do not understand the exact cause of autism. Boys are more likely to be autistic than girls. Press true or false. Correct. Symptoms. Signs of autism can sometimes be noticeable in the first few months of life, and other times they may not show up until a child is as old as 3 years. Since autism is not one specific disorder, each child may have a different set of symptoms. But there are some common signs that many children who are later diagnosed with ASD share. Not all children who have some of these signs will later be diagnosed with ASD. Autistic children share similar symptoms, and the progress of the disorder is generally similar. Press true or false. Correct. Because autism is not one specific disorder, each child may have a different set of symptoms. There are many signs and symptoms that a parent should watch for that may indicate that a child may have ASD. Here are 10 early warning signs that parents can look for, which may mean that a child is not developing normally. 1. Infants normally respond to familiar voices within their first few months of life and turn their attention to that familiar voice. If a child is not responsive to familiar voices most of the time, this may be a reason to be concerned. Sometimes, an infant that is not responding correctly will ignore familiar voices and instead respond to other sounds around them. 2. Usually, around the age of 1, a child is able to join a person in looking at something of interest. For instance, if a person points to something, a child will look towards that item and become interested. Also, children who are developing normally will often bring items of interest to others' attention. Not having shared interests with other people may be a sign that something is wrong. 3. Infants usually mimic the people around them. Children who are developing normally will mimic facial expressions, hand movements, and even body movements. Children with ASD rarely mimic. 4. Children with ASD may not respond to other people's emotions. When a child with ASD sees someone who is crying or upset, they may not respond at all. A child that is developing normally usually responds to this emotion in some way. For instance, they may try to comfort the person or become upset themselves. 5. Children with ASD rarely pretend play. A child with ASD may play with an object by touching it or moving it, but not interacting with it in an imaginative way. For instance, a child with ASD may take a toy plane and tinker with it in a meaningless way. A child who is developing normally might pretend that the plane is flying and interact with it in an imaginative way. 6. A child may develop normally and then suddenly lose language or social skills. For instance, a child with ASD may suddenly no longer be able to form sentences or use certain words that they could before. 7. Children with ASD may have abnormal body movements. They may move around constantly and have difficulty being still. They may also engage in repetitive movements like rocking back and forth, clapping, or flapping their arms. 8. A child with ASD may have abnormal reactions to pain, light, sound, or touch. A child with ASD may not have a normal reaction to pain and seem undersensitive to it. However, a loud noise may upset or even seem to cause pain to a child with ASD. 9. A child with ASD may get very upset when their daily routine changes. Even very small changes may cause a child with ASD to become very upset. Children without ASD may not like changes to their routine, but tend to adapt. 10. Children with ASD may have an extreme temperament. They may be very aggressive towards others or even themselves. They may also be overactive or even overly passive. A child who has at least 2 of the 10 most common signs of autism will develop the disorder. Press true or false. Correct. A child may have 2 or more of the common signs of autism, but may just be developing slower than normal. When to see a doctor. There is no single medical test that tells if a child is autistic. That is why doctors rely on parents, who are usually the first to suspect that there is a developmental problem. Call your healthcare provider if you think that your child is not developing normally. Signs that your child needs professional evaluation include: at 12 months, your child is not babbling yet. At 12 months, your child does not use gestures like waving or pointing. At 16 months, your child is not saying single words. Call your doctor if, at 24 months, your child does not use 2-word phrases. If the only time a child uses 2-word phrases is when he or she is repeating phrases they have heard and using them without meaning, then they are not using unique 2-word phrases yet. Your child loses language or social skills at any age. The following are 2 behaviors of a child who is 16 months old. Which behavior suggests that the child is not developing normally? 1. The child does not use single words. 2. The child does not use 2-word phrases. 1. Correct. At 16 months, a child should be using single words to communicate. The following are 2 behaviors of a child who is 22 months old. Which behavior suggests the child is not developing normally? 1. The child used single words to communicate in the past, but has stopped. 2. The child does not use 2-word phrases. Correct. When a child loses any language or social skill that they used to have, it means that they are not developing normally. A child should be babbling and using gestures to communicate at 12 months old. Press true or false. Correct. Children usually use gestures and babble by the age of 12 months. Which of the following is a warning sign that a child may not be developing normally? 1. At 4 months, a child is not using gestures. 2. At 24 months, a child is not using single words. Press 1 or 2. Correct. At 24 months, children should be using single words and 2-word phrases. A child who is developing normally will begin using single words around the age of 16 months. Tom is 20 months old. He uses gestures and single words but has not begun to use 2-word phrases. If Tom does not begin to use 2-word phrases by the time he is 24 months old, he is not developing normally. Press true or false. Correct. Diagnosis. Autism can vary from mild to severe and may have a different set of symptoms for each person. Because of this, it can be difficult to diagnose. There is no specific autism test. It is important to take your child to her or his doctor regularly to have her or his development checked. Although a specialist is usually needed for a diagnosis of autism, your child's pediatrician may be able to spot some early warning signs. To diagnose a child with ASD, a team of different specialists may give a child a variety of different developmental tests, including language, speech, and behavior tests. A full physical exam, as well as blood tests and a variety of other tests, may be done. Many times, the diagnosis of autism is not made until a child is 2 or 3 years old. It is important to get a child diagnosed early because the earlier treatment begins, the better the child may respond. There is a brain scan that allows doctors to tell if a child has autism. Press true or false. Correct. There is no single medical imaging test or lab test that can diagnose autism. Treatments. There is no cure for autism, but there are treatments and therapies. Treatment is based on the specific case. Treatment for one autistic child may be very different than treatment for another autistic child. Treatments are also constantly evolving and changing. Because of the wide variety of special needs that different autistic children have, treatment is most effective when it is tailored to each child. Treatment may include a combination of behavioral therapies that help teach skills and reduce problematic behaviors, speech therapy, physical therapy, medications to manage some of the symptoms, changes in diet. Conclusion. Autism is a disorder that appears in children usually before the age of 3. It affects how children talk, interact, and behave. There are different types of autism, and the symptoms of autism vary significantly from child to child. It is important to learn about early signs of autism in order to seek professional help. Seek professional help if you think your child is not developing normally. Things to watch for include, at 12 months, your child is not babbling yet. At 12 months, your child does not use gestures like waving or pointing. At 16 months, your child is not saying single words. At 24 months, your child does not use non-mimicked two-word phrases. Your child loses language or social skills at any age. Though there is no current cure for autism, there are many treatment options which aim at helping autistic children have a better quality of life. The earlier the treatments, the more successful they are likely to be. Ask your doctor if you have any concerns about the healthy development of your child.